The Ohio Health Information Partnership had the opportunity to discuss meaningful use with doctors from Geauga Family Physicians, a small independent family practice east of Cleveland. Each of the 3 physicians in the practice received an $18,000 incentive payment for the first stage of meaningful use. Here's what Dr. Melanie Carlson had to say about the help the practice received from their local Regional Extension Center.
The Regional Extension Center made it absolutely possible for us to get through meaningful use. We couldn't have done it without the REC. As an independent practice, we didn't have the support of any hospital system financially or with manpower to implement the data as needed to meet meaningful use. It's a very onerous process to get that data where it needs to be.
Dr. Carlson believes that the financial incentives for meaningful use show how the Office of the National Coordinator for HIT understands and cares about the difficulties of going electronic, especially for small independent practices like theirs. She looks forward to more interoperability and sharing of patient information through health information exchanges, such as our statewide CliniSync network.
I think the financial incentives that they're giving is very helpful because we see that they care and they are, thinking about small practices like ourselves that can't make this happen without a little help. If we didn't have ability to get some reimbursement for this, it may put us under. So we appreciate that, and we think that more of that is needed to encourage other practices to progress with meaningful use. And eventually we look forward to the capability of more significant interoperability between our system and hospital systems and lab systems.
Dr. Brad Moritz shares his views on being able to track and run reports for patients with chronic conditions and know how well the practice is caring for them.
Initially, I didn't like all these reports, but now that there's quantification in what we're doing, I truly feel as though it has helped us become better physicians, and because we have immediate feedback we can have immediate feedback on what we're doing anytime we want it. So it's been a good thing then.
Dr. Carlson discusses what she sees as the benefits to the meaningful use criteria.
I think ultimately I can see where meaningful use is going as far as getting different systems to put the same data in structured settings. And that has benefited us when we did meaningful use. There were a few things that it was triggering in my brain to do, probably a little bit more than I wasn't before. I know now that I have to check the smoking cessation box if they're smokers. I think I've probably nagged more smokers in the last year than I had previously. Also knowing that my pop-up box for pneumonia vaccine was coming up, it did remind me to do that.
Dr. Moritz says he hopes the Regional Extension Center program will continue so that as changes in health IT arise, there's help for small practices like Geauga.
I would like to see programs like the REC continue on based on the different levels of meaningful use as the years go by. I certainly would like to see programs like that help with major changes in the system that come down the pike. And I see the future is in helping us meet the standards as the standards change or are developed over the years.
The federal program for meaningful use can incentivize small practices that ordinarily would not have the resources to afford electronic health systems. We thank Geauga Family Physicians for sharing their experience with us.